There's never been a time in our history where people have been this interested in their health. Think about that, Aaron.
Yes.
Everyone, we read labels. We understand more about nutrition than we ever have. Gyms and health club memberships are all-time high members. People want to live long, healthy lives. And I think that plays in our favor because there's always going to be a segment of the population that want to keep their teeth their entire life, and they want to enjoy the benefits of great oral health throughout their life. And I believe that points the way for an opportunity. And I believe the best way to do that would be in a private practice setting, where you can set your fees, where you can attract people who are interested in what it is that you're offering. And in essence, break the pattern of the PPO plan that just wants to commoditize everything that you do. Break that pattern. And the best thing you could possibly do is successfully resign from those PPO plans, develop a relationship-driven practice where people come to you because they know, like, and trust you. You're truly individual. I think it back to a throwback in a really positive way, to a generations ago when healthcare providers really knew their patients. Much of medicine has been commoditized, Aaron. There still are private practices in medicine, but most physicians don't work in a private practice. Where do most physicians work?
Most physicians work for some kind of a
company,
big organization. Yeah.
Some kind of an organization.
Yeah.
They work for a health network. They work for a hospital. They work for something.
Right.
And I think if you look at the dissatisfaction level among physicians, it's at an all-time high. Physicians are trying to get the heck out of that profession instead of enjoy, an entire career of doing what they were trained to do, which is to take care of people. So The cool news is you have a choice. A third of the practices in England are private practice, and they are absolutely thriving. Those third are thriving. I have many friends that are private practicing dentists in England, and they love what they do. They see the future is very bright. They love their patients. They are able to attract quality team members. They're able to embrace technology. They're able to charge a fair fee for the quality of care that they provide. And they're looking at dentistry from a glass is half full basis. Really the profession becomes a tale of two dentists. There's a dentist over here that feels like the future, it's done, it's over. I might as well just go sign up and go work for something. That's one side. There's another side that is saying, oh my gosh, I can spend my entire career changing people's lives. Which camp do you want to be in? Take as long as you like. I think I have an idea. How about if you join this camp over here in private practice? So I think if you truly embrace it, if you look at all the ways that you could have a practice that stands out and that people want to come to, that are drawn to a practice like yours, then the future is just as bright as it could be. So my crystal ball, that's the way it looks in my crystal ball, Aaron, that there's going to be further delineation and further segmentation, just like happened in optometry, just like happened in pharmacies. There's other healthcare areas that's happened with as well. Where you don't want to be, Aaron, is the messy middle. The messy middle is a place you do not want to be, because now you're going to get the income of the lowest possible model and higher expenses because you're trying to distinguish yourself. You don't want to be in the messy middle.
Right.
And that's where most PPO offices are that way. Doctors are still taking lots of CE. They're embracing technology, but everywhere they look, their fees are being cut. Right. And that's like the messy middle.
It's like the bulls do well and the bears do well, but the people in the middle get slaughtered.
They get absolutely slaughtered. So you don't want to be in the, so I mean, this is a time to be decisive.
So let me kind of make sure I understand and rephrase what I heard, Gary. So you're saying, and I agree with you, but I just want to make sure that I say it clearly, say it back to you clearly. You're saying there are those who will appreciate quality dental care, just like they appreciate quality food, quality health. They are the ones carrying all these devices, checking on their health, wearing an Apple Watch. And there are tens and tens and tens of millions of people who give give a damn about their health and their well-being. And they will want excellent dental care. They don't want the lowest common denominator dental care. And it's already happening in other countries. Already it's happening in the US, but that's only accelerating. And then there are those that are on government mandated or PPO plan mandated health plans. And there it's all about the lowest common denominator. How can you do the same thing for half the price that you used to charge 10 years ago because your costs are up, but the payments are not keeping up?
That model is a race to the bottom. And I'm going
Right.
to politely suggest that's a race you do not want to win.
Right.
Because it's a booby price.
And the only people who can win that game is the ones with scale. That's where the DSOs come in, right? Because they have 3,000 locations, so they can negotiate and say, oh, I need better fees or cut my expenses by 50%.
They get economies of scale.
Exactly.
A simple way to say it, they get economies of scale that you'll never get as a solo practitioner or solo office. And as a result, they can compete in that space.
And that's exactly what happened in pharmacies, right? Because of this exact trend, only people who can survive are the ones with 1,000 locations, not that individual pharmacist.
Yeah, absolutely.